Coming up, we'll be on location at the Sculpt Center for Implants and Periodontics in Tyson's Corner, Virginia, discussing the latest advances in dental implants and how they can help replace missing teeth, restore your oral health and dental function, and regain that confident smile with one of this area's top dentists, Dr. Fadi Hasan. Welcome, Dr. Hasan, to the Top Doctors Interviews program.
Thank you so much for having me. I really appreciate it.
Oh, it's a pleasure. We've got a lot to talk about today. We're going to touch on dental implants, a procedure that can help so many people. But before we get into that, I wanted to just touch on your background and your vision for your great new, beautiful practice that you've built here in Tyson's Corner, Virginia. First of all, you're recognized as a top periodontist and dental implant expert throughout the Northern Virginia region. You've helped so many people get that beautiful, healthy smile. And you've got this really nice state-of-the-art practice that you just recently opened, the Sculpt Center for Implants and Periodontics. You've got the latest and greatest state-of-the-art technology, really beautiful design. I mean, it's very impressive. It makes me feel like I'm in South Beach. I wanted to ask you about your vision for your practice.
My vision was, when I decided to open my practice, is to create something that's going to be more clean, modern, minimalistic, and also futuristic as well. Have that an art design behind it. I decided to choose the name of the Sculpt Center is because my passion comes a lot with sculpting the tissue. That's where my passion comes for the periodontics itself. So for me, when I practice my profession, I pretty much put all my time and effort in each and every case, and I go above and beyond what I would say any other periodontist would do. And I feel like my patients see that passion in it, and they are usually just as excited and as enthusiastic in going through their treatment as I am, going that journey with them. So that's kind of the vision I see myself going through, is that I want to be that cutting edge and leading periodontist that has the most advanced technology, from our latest CT scan to state-of-the-art microscope that we're using for our advanced microsurgeries. So that's kind of where I'm seeing myself, in the next hopefully 5 to 10 years, and keep evolving around that and just providing that quality service.
Well, it's definitely a great vision and a great model, very unique. I mean, there's not really any other practice that I'm familiar with that has that type of approach, because you really not only get down to the precise great results for your patients, but you're also an artist, like you mentioned, because you're kind of redesigning their smile as well, which affects their life and every
Absolutely.
aspect of their confidence as well.
That's the whole premise and idea behind is that what can we do as professionals and as periodontists to kind of establish that that trust with the patient and make them go through that entire journey, requiring sometimes 1, 2, 3, or even 4 procedures just to get there. So it takes time, effort, dedication, and like I mentioned earlier, is that the passion to continue and delivering that same quality and consistency again and again. And as you mentioned, it is art in a way. I mean, that's what we work in millimeters and half millimeters, and I feel like, for us, everything counts to make sure we get that exact aesthetic match from a gum line level to the bone level. That's where the art part of our profession really shines and comes through, So that's kind of where my passion is about it, and I really, truly enjoy doing it.
And you're actually affecting the facial appearance as well, because dental implants can really help reshape your face.
Absolutely. I mean, if you're talking about people who have a lot of missing teeth, most of our patients will come and tell us, like, I feel like my face is shrunken or it's sunken, and having dental implants with their crowns at the end that's been fully restored, that does give them kind of the smile back, the confidence, the aesthetics, the functionality that they can really use on day-to-day basis, and having them leave with a beautiful smile on their face and that they are really confident about it. So that's where the quality about dental implants comes in, and the importance of it in our day-to-day lives. So that's why I think it's an incredible service that we are providing for our patients in today's day and age.
So getting down to the basics, we hear about dental implants all the time. We've been hearing about it for years, and I know there's been so many advances in dental implants, but what exactly are dental implants for for those people that don't know?
I would like to call it another replacement for your lost tooth. It functions like a tooth. It behaves as close as possible to a tooth, and it's like a root replacement. In other words, that's a good way to really describe it in the lamest terms. Is that it's a root replacement therapy made of titanium. There are really new products out there, advanced technologies that combines titanium and other products to make it even stronger, more durable, and lasting much longer than other implant systems out there.
What would you say are some of the key benefits that patients can expect from dental implants?
It preserves your bone and the jaw as well, and also the soft tissue, the gum around it. So we like to say is like, as long as you use it, you don't lose it. So which means that if the bone where the implant is inserted is in function, it actually helps maintain that bone staying alive, in other words, and also it maintains the width and the height of the bone. So I like to always compare it, and I explain this to my patients every time. It's like imagining you have a muscle that you're not working out. If you don't work out your muscle, you ends up being kind of thinning out and shriveling. Bone behaves in a similar way. So as long as we are able to use that bone for a dental implant, that dental implant, as long as it's in function, being used, it helps preserve the bone for long term. What does that mean for the patient? Well, it helps maintain their structure, their anatomical structure in their jaw. So there you see less shrinkage happening. The great thing about it is that patients can get back to function again. You see a lot of patients will ask us, is that, can I bite into an apple again? Can I eat corn on the cob? Can I chew my steaks? And the beauty about it is that yes, you can. And then I always tell them, like, when you get your tooth, promise me to come back, and I'll get you an apple or corn on the cob. You can bite it in front of me, and I want to hear that crunching sound with it. So they get a laugh out of it, but it really brings that functionality back again. And then, more importantly, is that when patients are able to eat properly, it improves their overall health. So that you look at it not just from a tooth point of view, but an overall health point of view, from very soft liquid diets to more sustainable, high quality food that they can eat. They're improving the patient's overall health, and that's where it becomes really important for them. And in addition to that, also they are able to get their aesthetics back. They can smile more confidently, especially if they've already lost 1 to 2 front teeth, and you're able to recreate that, the architecture of the gum and the bone, and make sure that it looks as natural as possible. And they provide you with that smile, and you always ask them, like, well, which one is the implant? And when the patients don't know which one is the implant, that means that you've really touched upon that high quality service that that they can't even distinguish a natural from an implant. So aesthetics comes to really matter at the very end of it, because again, they can go out, they can smile, they can meet other people, and that provides a service again like nothing else with it.
Well, those are some major benefits. I mean, you're really giving them their lives back, because they get their confidence from their smile back. They're getting the ability to eat the types of foods that they weren't able to for however long they were missing their teeth. And not to mention, of course, as you touched on, the aesthetic side as well. Now, is everyone a good candidate for dental implants? Like, anyone that misses a tooth or loses a tooth can get a dental implant? How does that work?
Great question. Most people are great candidates, depending on, of course, you have to look at always their patient's medical history. If there's anything underlying, let's say, systemic problems that we need to be aware of. But let's say if they are healthy from a medical point of view, it all comes down to, well, what's the quality and the quantity of bone that the patient presents with? Do they have enough gum that helps support the bone and support the future implant and the structures around it? So those come in factor when the patient presents for a consultation. We look at all these factors, take into consideration. That's when a patient gets their CT scan to actually analyze the amount of bone that they have and to see what's available. And based on that, we can then determine if they are a good candidate or not. But generally speaking, if they have good bone, then they're a great candidate for it.
Are there any age restrictions? Like, say, if it's a person that's in their 80s or...
From an age restriction, I have patients as old as 90, 95 years old. 97 is the most recent one that I've been very lucky and blessed to treat, and she wants an implant. So I was like, all right. I was like, I want to live to another 13 more years until I'm 110. So, I don't think there's an age restriction factor to it. We are more cautious with, of course, with younger patients. So there's from a young point of view, but as we mature older and especially beyond the ages of 18 to 20, 25, most of us are very excellent candidates to having dental implants in our mouth.
One of the advances that we've heard of are the All-on-X dental implants. Could you tell us what they are and how they're different than regular dental implants?
So All-on-X dental implants, they are standard dental implants. The difference between is that those are for our patients who have either severe, let's say, worn down dentition or teeth that you can't restore anymore. Either there's too much decay or there's too much periodontal disease that the patients are facing with, and it comes to a point where, sadly to say, but those teeth need to be removed. So they can be excellent candidates, most of them, for what's called All-on-X, which is like a teeth in a day, where most of the teeth or all of them are completely removed. Everything is cleaned out, all the infection that is present, if there is any. And then implants are placed in strategic positions in order to get the maximum stability of the implants. And hopefully by the end of the day, the patients leave with a fully fixed, full mouth rehabilitated, that they can start slowly functioning with in the first few months. And that gives them pretty much, I would like to say, they walk out with a brand new set of teeth. So it's a credible service that can be delivered for them usually the day of the procedure, and that's our ultimate goal for all of our patients, is that they are able to get that service. It's a team approach, which is really important, where we work with our restorative colleagues, and when we sit down as a team, the patient, which is the most important person in this entire collaboration, the surgeon, we have the restorative doctor as well as the dental lab, and we look at the entire face, the occlusion as a whole, and to see what works the best. And based on that, that's when everything gets delivered to the patient on that day of the procedure. And pretty much they can function with it by 4 months, 3 to 4 months. The patient does receive their whole new set of teeth, which is the stronger quality one. And that's when we usually like to present them on that day some food with it, and they get to eat it in front of us, because I'm sure they've been really very anxious and desperate to eat that first bite of that good, strong quality meal. So it's an incredible, life-changing just procedure that you can provide for them. And you'll see them by the end of it, the tears in their eyes and the smiles on their faces, and usually like to bring their family members with them, because it's just incredible. And I have patients that I've been seeing them for almost 5 years now, annually, and every time I see them, they'll tell me, thank you for changing my life. It's been great, and I couldn't be happier. It's an amazing service. It's very emotional at the end of it when it's all done.
Yeah, that is so impressive. I mean, literally you're changing people's lives. I mean, you mentioned how they can come in and literally walk out with new teeth that same day.
Exactly. So that's the whole purpose of these procedures, is that our ultimate goal is always to see if we're able to get that good implant stability. So when they are able to leave, they're able to leave with teeth in their mouth, their bite is in the right place, and they are actually able to go home, smile by next day. They're slowly introducing soft diet, but usually by 4 to 6 weeks, they start eating more semi-solids, and it's incredible, life-changing, because you're talking about people like their spouses are there with them, or their sons and daughters, and they've never seen their maybe significant others or any of their family members smile. And to walk out of that procedure that same day, and there's some of them are able to smile once the anesthesia wears off, and it's amazing. Like they start crying immediately the day of, and it's very, very rewarding for all of us who've done it and been there in that surgery room at the end of it. It's just it's one of those most touching, life-changing services that you can really provide, and it's incredible.
I can really see your passion for what you do. You're really changing lives. It's no wonder that your patients love you. I mean, you've helped so many people throughout the region. Now, if someone's missing teeth or has an accident or broken tooth or has several teeth, what's the process that they can expect from when they first reach out to you?
So usually when patients present, let's say with an accident, let's say they lost one of their front teeth, aesthetically driven, for example. The first thing we tend to do is that we'll take a CT scan to evaluate and see, well, what's the status of the bone? Is there any existing infections? And are we able to do what's called an immediate implant, which means can I remove the tooth if it's non-restorable? And can I place the implant the same day and also have them leave the same day with a fixed tooth? So that's a service that we provide. We've been providing it for over 8 years at this point in time in my career, where we have a lot of trauma cases. They come in single teeth, front teeth, and we're able to deliver that quality the same day, which means the service that same day. Remove the tooth when it's non-restorable, place our implant 1 to 2, maybe more, and have them leave with fixed dentition, not something removable where they have to remove at night, but actually fixed teeth that are stabilized directly to the implants. And it looks as natural as they can possibly get it. And many patients are like, oh my God, I look even better than I walked in. So we were able to really deliver that quality consistently, time and time again. And hopefully we'll have a chance to show you all the cases that we've done it over the years too.
Patients are getting great results. The key is that you take the time with each patient, because every patient's unique, every situation is different. And by the fact that you're able to take time with each patient and really understand their specific case and their needs, you're able to provide those great results.
Thank you.
So you kind of touched on the process here of what patients can expect. Is there any downtime for patients after they have this procedure?
So usually downtime for dental implants, whether it's a back tooth or a front tooth, I would say honestly most of the time patients need maybe a 24 by 48 hours. A lot of them are back to work again. Usually the downtime, after placing an implant is very, very minimal. How do I know? Is because basically you can they ask for a Motrin or Tylenol for the first 24 hours, and most of them will tell you, yeah, by day 2 I stopped taking any medications. A lot of them get to go back to work within 24 hours from placing a dental implant. So the recovery time tends to be a lot faster and very comfortable as well. So that's the kind of the downtime of it for dental implants.
And how long do the dental implants typically last? Is it really like getting your teeth back?
I always tell my patients they will last as long as you maintain them, which is very similar to our teeth. If we maintain our teeth, we see our dentist or a hygienist regularly, every 4 months or 6 months, annual, quarterly, let's say. There is no reason for implants not to stay. I have seen implants as old as 30, 35 years old. Those patients are very diligent in maintaining incredible oral care, home care, and maintaining their hygiene appointments regularly with their dentists or their periodontists. So they can last as long as you take good care of them, just like any other thing that you buy and maintain.
Well, Dr. Hasan, that was very informative.
Thank you.
Dental implants seem like a no-brainer. If you're missing teeth, it's literally like getting your teeth back. You mentioned how the downtime is very minimal, discomfort is minimal. It's definitely worth it. And if I have to lose my teeth, I'd definitely be coming to you, Dr. Hasan.
Thank you so much.
Thank you so much for joining us.
Thank you, sir.
All right.
I appreciate it. Thank you.